This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. So we started to use more and more ketamine for pain in the emergency department. We call subdissociative dosing of ketamine, like 0.2 to 0.3 milligrams per kilogram of ketamine to try and avoid opiates, or sometimes opiates just aren't working well for people. But one of the times that people might not want to use it is if you're worried about, even if it's subdissociative, sometimes people have a reaction to it. Sometimes people kind of freak out with ketamine. So there's been, questions of what other drugs can you use with the ketamine to make it, not give people a bad experience, a bad trip. There was a study that came out recently that actually looked at combining potentially two of our favorite medications, ketamine and Haldol, in the emergency department compared to fentanyl for pain, and to see if it, if people tolerated that well. So this study was a pretty cool study. It was actually done in Iran. They compared Haldol at 2.5 milligrams plus ketamine at 0.3 mg per kilo, so a pretty good dose of ketamine, compared to fentanyl, a mic per kilogram, so a pretty good dose of fentanyl. And they kind of wanted to see if who did better in terms of pain, and was there, a lot of agitation. So in terms of pain, the ketamine and Haldol actually did dramatically or significantly better than the fentanyl at kind of multiple time points that they followed. So it was better in terms of controlling pain. It was quicker to be pain-free. There was less need for rescue medication with the ketamine and the Haldol, so it worked very well for pain. Patients were more satisfied with it. And then in terms of kind of agitation, there was only like one spot at about 10 minutes that the patients who got the ketamine had a little more agitation than the fentanyl, but otherwise at other time points there was no difference and patients tolerated it very well. There was not a group with just ketamine, so maybe low-dose ketamine doesn't have a lot of adverse reactions, but it does seem like in this study worked very well to control pain. Patients weren't very agitated. So I think it's probably, worth trying. I mean, Haldol does have other pain benefit as well. It's antiemetic. So, next time I'm thinking about using low-dose ketamine for pain, I might add a little Haldol to it. So we'll see how it goes. Thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.